Hello and welcome to today's webinar as part of the RLAS webinar series. This is the second module in the series. It's titled A Dynamic Adaptation Process for Implementing Evidence-Based Strategies. I do want to acknowledge our funding source for both the RLAS project as well as the webinar series. It was funded by the Eunice Kennedy Shriver National Institute of Child Health and Human Development. Before I get into today's material, I'd like to stop for a second and introduce myself. My name is Amy Green, and I am a clinical psychologist and implementation sciences researcher. While you're probably familiar with what a clinical psychologist does, you may not be familiar with implementation science. Implementation science is the study of how we take practices that we have research that we know work, things like the strategies that we'll be talking about today as part of the RLAS project, and how we take those strategies that research has shown are effective in implementing positive change, and we implement them and make them work in settings. If it was as easy as saying, we know this works, and so you do it, our job would simple and be over. But instead, what happens is there's a lot of barriers. There's a lot of reasons why what science says works doesn't always happen in practice. And so this presentation will give you some background into the strategies that we're going to use as part of the RLAS project to really implement these strategies from an implementation science background. That is, what are the things that we can do to ensure success so that the work you're putting into these strategies really shows up and works in the long run. Again, I am a clinical psychologist. I'm licensed as a clinical psychologist. I have a background working with children and adolescents, but my current research is really focused as a person who investigates the better way to get treatments and services for kids rather than that sort of one-on-one clinical psychologist role. And so I'm currently employed by the Department of Psychiatry at the University of California, San Diego, and I work as part of a group called the Child and Adolescent Services Research Center. So the area of specialization, again, being implementation. We'll also today talk about, again, the title is Dynamic Adaptation Process. We'll talk about the idea that there are sometimes adaptations needed, ways that we need to change that what we know works in science and in research studies to really fit your context in schools. And so the strategies that I'm talking about today in this dynamic adaptation process are actually something that I've developed along with Dr. Greg Ahrens, who is doing one of your other webinars to better help organizations, communities, schools implement these evidence-based practices and fit them to their context. Okay, so the objectives for today's presentation. By the end of the presentation, you should be able to list the key components of the dynamic adaptation process, which I'll be going over with you as part of the presentation. You'll be able to describe the skills that you will need to develop action plans. So the second part of our presentation today will really focus on the development of action plans and assessment to help you move forward in implementing these evidence-based strategies. And you'll also be able to list the components required to manage and monitor implementation of evidence-based strategies. Okay, so with that, I'm going to get started into the first part of our presentation today, which will really talk about how we do this dynamic adaptation process. What does it mean? And why are we spending all of this time and an entire webinar, in fact, on the idea of implementation? And as you'll notice in the presentation, a lot of what we will talk about aren't rocket science. They're not things that, although sometimes when you see some of the figures and graphs, we make them look overly complex, they're really participatory planning processes that, when given the time that they need and the attention that they need, really help us to promote the success that we want to see. And so I like to start with an example of what happens when this process maybe isn't followed according to all those steps. And so as you'll note on your screen, there's this meal with the word Colgate above it. Most of you will recognize Colgate as the company who makes toothpaste, and so you will associate them with toothpaste. What you may not know is that in the 1980s, when there was a big craze in making microwave meals and pushing them out to the public, Colgate decided, the toothpaste company, that they wanted to get on board. They thought, this is a really good business venture. We can do this. We have, factories, we have space. And so Colgate branched out as a division to go into the business of making microwave meals. And they spent lots of money, lots of time, and lots of resources developing the meals, developing the menus, packaging them, and they thought, okay, we'll just slip our Colgate logo right on the box there. People will recognize that. And what happened was that despite the fact that many of the other microwave meal companies, some of which were virtually unknown, were having success, Colgate failed. And Colgate didn't necessarily fail because their food tasted bad or they had a major problem that caused any sort of disease or bacteria. Colgate failed because people saw Colgate slapped on a box of food and decided they didn't really want to associate toothpaste with the food they were going to eat. And it's known as one of the biggest marketing fails in the past couple decades. The idea that that planning process, that idea, that skip in the marketing process of really thinking through what will people think. I'm sure that most of the people listening to this webinar, if I said to you, hey, we're going to take a toothpaste logo and slap it on food, would say, oh, that doesn't sound good, that's a bad idea. But through their process, when they were rushing to market to make sure they didn't miss it, they skipped that step. They skipped the part in the marketing phase where they go out and they look at the data and they test to see whether or not this is a good idea. I'm pretty sure had they run a focus group, people pretty quickly would have told them that slapping your toothpaste logo on a bunch of food doesn't work. And so part of this project is to help you not become a Colgate, to help you plan, to help you think through those steps. We've developed this process called the dynamic adaptation process, and it's really just a phased implementation planning process that helps you collect data, to look at the barriers, to look at the strengths, and to really develop a well-rounded plan that helps you implement these strategies so that you don't end up in a Skahokel zone or a Colgate box where the time, the money, the effort was there, but in the end, we sort of mix the box and therefore waste that investment. And so what is this dynamic adaptation process? Well, it's, as I said, it was developed by myself and Dr. Ahrens over a process of time and trial and error, really working with organizations to figure out how is it that what we know from the research and we know should work doesn't always get translated into what happens in the real world and in communities. And so we've developed this structured planning process that I'll go through in the next couple of slides that really helps to collect the data, to look at what's happening in your school, to look at what might need to change before you're able to implement these strategies. It's not unsimilar to something that some of you may be familiar with in terms of other public health planning processes, or something like the nursing process, where you go through a stage of assessing, collecting your data, deciding what the best options are, implementing that change, implementing that treatment, and then looking to see, did we have that effect? Do we need to change things? Do we need to shift course to better get this, in this case, strategy implemented? Now, in something like the nursing process, your goal is usually to treat a patient. In something like our dynamic adaptation process, our goal is to treat a system. So in this case, a school. So our patient isn't a student, our patient is the school. And we want to go through this structured planning process so that you're able to change your school and assess your school to make sure that you're getting the processes implemented in the way that they're supposed to be. As part of this process, we'll also provide you with a lot of support. So this grant provides us with the ability to provide webinars, this one as well as others, such as the ones on understanding bully and understanding transgender and LGBTQ students. We have other in-person trainings. We provide technical assistance. We have a set of coaches with expertise in schools and school nursing, with expertise in LGBTQ issues. And these coaches are individuals who will be with you every step of the way through this dynamic adaptation process. They'll help you collect the data. They'll help you interpret the data. When I get to the second part of our webinar today, where I talk about the strategy planning and the action plans, they will be there to help you go through that assessment and plan. Our team will also provide data feedback. So we'll collect data. You may be aware that people have already been doing some surveys with individuals in your schools, as well as interviews, and we'll continue to do those over the course of the project to collect that data. Our team will analyze it and provide it back to you, and then the coaches will work with you to interpret that and decide how to make the best decisions for your school. And so the dynamic adaptation process really is a team approach where we draw on the strengths that you have and other individuals within your school bring, along with our team's expertise in areas related to the strategies and areas related to school nursing and in areas related to implementation science. So you may be wondering, well, what's the adaptation part? Why adaptation? Well, what we know is that when we take strategies or practices that research says it works, and there's often very structured ways that they are listed about how they should be done, and we put them into real world settings, that there's often ways that they need to be adapted. These strategies and other practices are not often one size fit all. And that's a critical challenge for us in the implementation world. How do we take something that we know from research studies works? How do we take a strategy that we know, for example, implementing GSAs in schools creates reductions in bullying and decreases in depression? How do we take what's been done in a research study, which are often tightly controlled, and we take those strategies and we implement those in different schools that may have different policies, different practices, different leadership, different neighborhood factors? And so as part of the dynamic adaptation process, we start from the beginning by saying, we know adaptation happens. We're not going to hold you to it has to be exactly as it says in the research. We will say that there are sort of a balance between there are core aspects that we want you to maintain, but we'll also help you in figuring out what are the adaptations that you can make so that this better fits your school setting. We want it to fit because the better that it adapts and fits, the better chance you have for long-term sustainment. And that's something that we know from the research. If we force you to do something that isn't a good fit, just because the research said it should work, in the long term, it doesn't end up sustaining. If we allow you to take something and adapt it so that you still have the core elements and then fit it to your school context, what we find out is that you're better able to sustain it, it fits better, it continues in the long run. And that is part of our end goal. We don't want this to be something where during the 2 or 3 years of the project when you're implementing, you're really great at doing it and you follow what we're telling you to do, and then the project ends and you say, wow, there's no way we can keep this going without their support. Our goal is for these changes to be sustained in the long run. And so by addressing the adaptation and the ways that it best fits with your school now, we're better able to help you so that you can sustain these changes in the long run and ultimately impact more and more students. Okay, so I'm going to now get into the sort of nitty-gritty of this dynamic adaptation process. It covers 4 stages, which you'll see in the next model. The first stage is exploration. This is when we collect data from the schools. We try to understand the problem. Are there higher suicide rates? Are there higher bullying rates? Are there students who are missing opportunities to get help? And so this is part of the web surveys that you've been collecting. We're taking data from the RLAS. We're doing interviews. And so we're really exploring that problem. Preparation is where we'll take that data and we'll provide it to you. And we'll ask you to come up with some ways to plan and develop action plans to best help your school adapt and implement these 6 strategies for change. Implementation is when you actually start working with your school and implementing those changes. When you start, again, we'll do 2 strategies each year, but when you start with those strategies and you start making changes. And then, of course, our important phase, not to forget, sustainment, the idea that we look at what we've done. Do we need to make changes? How do we best keep this going in the long run? And so now for the next part of the presentation, I'm going to go through each of these stages in a little bit more detail. And as I mentioned earlier, while it is a very simple process, as researchers tend to do, we make figures that make it look really overly complicated. And so I'm going to break this down, but this is our model. This is our figure, which we've published and used in multiple studies that describes this dynamic adaptation process, or DAP as I may refer to it as. So I'm going to start with this. This is the exploration phase. what you'll notice in this model is here are the phases I just mentioned: exploration, preparation, implementation, sustainment. And for each phase, you'll notice there are some key steps that occur in it, and that each of those steps really feed into other stages. So exploration feeds into preparation, which feeds into implementation. And then you'll notice the sustainment phase really feeds back into the other stages so that we can constantly make changes, so that, again, it's a process. It's not an endpoint. It's one where if we need to, change a strategy because we find it's not working as well, we collect that data, we go back, we prepare, we implement, we sustain. And the goal of this process, and the way we've used it before, is to get you from the idea of, here's a problem, our schools are having much higher suicide rates among our LGBTQ students, and sustainment of, here are the strategies that we're doing, these are the changes we're making to help them. So let me start going through exploration now. So exploration is the stage where we're really collecting data. This is the stage where we're exploring the problem, we're collecting data, and we collect it at multiple levels. So we'll collect data from your school about leadership, culture, and climate, and I'm going to go through these in the next slides as well. We'll collect assessment data about you, about the IRT lead, about your strategy attitudes, your work attitudes, and then we'll provide data about your student body of your school. Okay, so let's start with the beginning with problem identification. And so this is data from the 2013 New Mexico Youth Risk and Resilience Survey. And what we've seen, and this is where this idea for this project really came from, is that our suicide rates among lesbian, gay, and bisexual students are 42.7%. These are considered attempting suicide. So almost half of lesbian, gay, and bisexual students have considered attempting suicide in the past 12 months. These are from New Mexico high schools, compared to 13% of straight students. And so this is what we would consider a public health problem. This is a very large group of students who are having thoughts of suicide and considering suicide. So the first part of exploration is identifying, we have a problem. There's increased depression, there's increased suicide, there's increased bullying. This is occurring in schools throughout New Mexico high schools. The next part of exploration is the idea of, okay, there's a problem. Is there anything we can do about this? And in this case, there are potential solutions. The Centers for Disease Control has a list of 6 strategies that are based on the research evidence that they've developed and promoted for high schools to improve school climate for LGBTQ students. Problem is that while they've identified, and this is what I call the implementation gaps, so they have some ideas. They have 6 strategies that research has said, if your school does these things, you will be able to reduce the suicide rate and improve the school climate for your LGBTQ students. Only 13% of schools nationwide are actually doing those strategies. So our goal in this project is, there's a problem, we know some solutions that might work for this, how can we get those solutions into the schools? Okay, so we've got the problem, now we need to look, we have a potential solution, we need to look at what's the context, what are we going into here? We can't just say, here's the 6 strategies, please take these and start doing them, just do it. We could say that, and what we would find is that not much would get done. And so our first stage is to assess the school. What are some practical concerns? Are there staffing concerns? Do we not have an individual who is able to take on this project and to lead it? Is there not support at the higher school level? And so as part of this project, we went to schools throughout New Mexico looking to see if we could get administrative support, staffing support. If you're viewing this webinar, you've passed this stage because your school has dedicated the support that's needed from that level to be part of this project. Then we also need to go a bit further and find out, what are the training resources? What is the time? Do we have the right setup to set you up for success at the school level? Does your school approve the meeting time to meet with your implementation resource teams? Can you meet and start working on this? Other things that we know at the school level that are associated with success our leadership support. Does your school leadership support you and others in implementing these change? Again, these are factors that we're measuring both through our web survey that we've submitted to school leaders and principals, as well as the interviews that we've conducted with them. We'll also look at school climate. On a school level, what is your school climate? Do you have a school that's resistant to change? Do you have a school where there are people who feel like they're already overworked, overstressed, and they can't do one more thing? And if so, how do we work with that going forward within that context? And so again, at the school level, we're identifying key areas so that we know what are the strengths and what are the areas that we may need to consider and work within the boundaries of when we're implementing. We also conduct staff assessments. So those of you who are listening to this webinar have taken part or will soon take part in one of our web surveys, our staff surveys, that identify factors that we know are associated with better implementation. So looking at the attitudes that you and others in your school have towards LGBTQ populations, looking at your emotional exhaustion. Are you overworked, overstressed, and unable to take on one more thing? If so, how do we work with that? How do we perhaps, again, as part of adaptation, consider that maybe we need to implement some stress management techniques as part of our training, along with training in how to implement these strategies? What are your leadership skills? Are you someone who is able to take on projects and get people behind you, or is this an area where you've really kind of held back before? If so, we have a webinar specific to leadership skills, but we can also provide additional training and coaching in that area where indicated. Again, as you'll see as I'm going through these, the idea is not to say something's wrong or something can't be overcome, but to see what are the areas that are looking good and what are the areas where maybe we need to provide some additional support so that you have a better chance of succeeding. It's all about figuring out where support is needed and then providing it from our team. Then we'll look at your student characteristics. So we have data from the YRRS. We also have your reports of your experiences working with LGBTQ students, and we'll use that information to provide school profiles. So you will be getting reports that will show the data overall from your school, your staff, and then also your students. So the first chart that I showed of considering suicide among straight versus lesbian, gay, and bisexual students was for overall New Mexico in 2013. We're now looking at the 2015 data, and we're looking at school by school so that your school will have individualized data about bullying, depression, suicide, fears of safety, and other key indicators that we have from that data that we can provide to you to help you better understand where are the areas where you need to focus most to support your students. Okay, so now that we've conducted our assessment, and as I said, we've conducted most of this data, we have a little bit left to do, and then we will be providing you with feedback reports that you will use with your, next part, implementation resource team. So we don't want individuals to feel like the entire burden of change is on their shoulders. And in fact, what often happens in those instances is individuals feel burned out and unsupported. And so a key part of the dynamic adaptation process is the creation of these implementation resource team, or as I like to think of it, the superhero team. So as the implementation resource team lead, those of you viewing this webinar, you'll be the individual who will be responsible for creating your superhero team, for finding the individuals who you think can best help you address these problems in your school over the next couple of years. Okay, so we have that data, and then what you're going to do with your implementation resource team is you're going to figure out how to take that data. So you will have meetings with your team and you'll figure out how to use it to develop your action plan going forward. That's really the key part of the preparation phase, is deciding how do we plan using this data for success? How do we implement these strategies? How do we prioritize what gets done and decide how it gets done and who does it so that we can have success? Okay, so your implementation resource team. Here are some suggestions for you when developing your implementation resource team. One is to keep size manageable. Now, we don't want you to feel unsupported and like you're the only person at your school working to make these changes, but we also don't want you to feel like you need to manage a team of 10 or 15 people with diverse views and diverse schedules. And so we've found that a team around 4 to 6 individuals is both manageable, it's able to get a diverse group of perspectives, and it's able to get individuals who are more passionate about the area. We recommend that you would meet with your IRT team at least monthly in the beginning. As the time goes on, there may be times where you are not needing to meet quite as much. There may be other times, particularly when you're ramping up to implement a new strategy, or when there's a barrier that's come up that might put a little hinder on your ability to really implement. When that happens, then you may need to meet more regularly. Those coaches that I mentioned and that I showed pictures of 3 of them on one of the earlier slides are RLAS coaches. They're really there to support you in multiple ways, and you can consider them part of your IRT team in the fact that if you need them to be there for a meeting, if you would like them to help sit with your team and really think through these ideas, they are available for that. Particularly in these early preparation stages when you're really digesting the data and the feedback reports that we give you and deciding how to make action plans. Your coach will be there in person, on the phone, in video, whatever format you prefer, to really walk you through and help you develop those plans and help you decide how you're going to prioritize and implement these strategies. When you're selecting the individuals for your team, you want to select them for individuals who have interest in working with LGBTQ students, individuals who have a drive to really make change in their school and to improve school climate, individuals who may have roles in your school that would be crucial to the types of changes that we're making. So for example, in terms of these positions, some suggestions are school nurses, social workers, school psychologists, your health educators, counselors, Genders and Sexualities Alliance club advisors, and other key opinion leaders in your school who are able to come together really with this overarching goal of improving your school climate for your LGBTQ students. Depending on the rules and regulations at your school, you may also consider actually having a youth, an LGBTQ youth, join your IRT team to really provide that student level perspective. Again, this may vary by schools based on whether or not it's permitted, but it is something to at least consider, the idea of having that youth voice as part of your meetings. Other suggestions for your IRT team selection are to pick partners who are committed, individuals who are reliable, who are willing. If it's someone who really has a lot of interest, but who lets you know that they're so busy, but they probably couldn't really go to the meetings, but they really support what you're doing, that may not be an individual who's appropriate for the IRT team. It's great to have lots of supporters and advocates in the school. So that's a facilitating factor, actually not a barrier, but you do want to make sure that the individuals who are on your IRT team are actually able to meet and to help you in this process. You want ones who have some knowledge or skills to share in this area. So for example, many of the positions that I mentioned in the previous slide, individuals who, I like to say, play well with others, those who can listen and be willing to understand others' views. You and the members of your teams may not always get along, and that's good. That's another reason why we have 4 to 6 people, so that it's not all going in one place. I imagine that Colgate would have liked to have someone in the room who said, hey, maybe it's not a great idea to slap our toothpaste logo on the box of food. So you want other ideas and other perspectives, but you want people who are able to listen and understand and really consider those views rather than shutting people out. Also individuals who are well respected in your school and respected by others who work with them. So as I mentioned, one of the roles for your IRT is going to be, in this preparation stage especially, to review these feedback reports. So our team will present in easy to digest formats. So no fancy research analyses and descriptions that you can't understand. We'll have graphs, pictures, numbers that really show the data for your school with written overviews summarizing how your school compares to schools in New Mexico in general. Your IRT will also help you assess your school and develop action plans. So the second part of our presentation today will be talking about the development of action plans using this school-wide self-assessment planning tool. Your IRT will also help you understand where are these adaptations. As part of that, I or another member of our RLAS team may also sit in on some of your IRT meetings or call into your meetings to help you determine whether or not an adaptation is something that we would view positively or if it's something that might take away or negatively impact students. In most instances, the ideas that you have for adaptations and the ideas in other studies that individuals have really help better fit the strategy to the school. And so for us, it's just a part of making sure that it fits, talking it through with you, and then having you go ahead with those adaptations. But again, these are all parts that you as an IRT team will work together to do. You'll also address, so not just the barriers that we see in the beginning, but ongoing. As you know, working in a school, things don't always go as planned. There are often times where the best plans are started out and you start really working and a policy changes or a staff member leaves your school or a crisis occurs. And we recognize that life doesn't always go the exact way you plan. And so part of the IRT is when you're meeting to discuss what changes have occurred in the school context. Are there things that we need to continually adapt, that we need to continually monitor to change so that we stay on course? Even if the principal who was so supportive of the project left and now you're unsure who will come in and how it will continue, we want to monitor that and work with you so that we can strategize rather than feeling overwhelmed and like you're stuck. We see these barriers as just hurdles to overcome rather than stop signs. And so as you're going along, we'll continue to collect this data for you. You'll review your progress, including how well are the strategies being implemented? Are there problems? Are there areas where you're moving even faster than anticipated? And then amending those action plans and those steps that you need to take as necessary so that you can continue. So just a few tips for engaging others in your school as well as IRT members. So really trying to get everyone on board. One tip is to create a friendly and respectful atmosphere. So starting things off in a really collegial, friendly way rather than straight down to business and here's what we need to do. Developing those relationships with your IRT team members where you can have mutual respect and cooperation. You want to talk about specific details, including why each person was selected for this team. What are their roles? What was the reason why this person became a part of the team? And how do you see them as helping to move the team forward? Then matching some of the tasks. So, and we'll talk about this with action plans, as you develop the steps that you need to take to move forward, who will take on each of those tasks? And making sure, for example, if you have a health educator on your team, and one of the strategies is to improve the coverage of LGBTQ issues in health education materials, that might be a natural fit for your health educator to help lead. And so really matching the skill set of the individual with the tasks that you're assigning. You'll also want to collect feedback, and we'll do that as part of our data feedback, but it's good for you also as you're going along to check in and see how individuals are doing. Do they feel like we're making progress? Do they feel like their voice is represented? When conflict occurs, instead of pushing someone aside or over talking, really discussing why there might be different perspectives. What's the cause that's happening? Why are differing views coming up? How can we work to make sure people are back on the same page, or at least understanding and appreciating the other diverse perspectives? And then we also suggest, again, these are individuals who are really helping to take on this challenge in schools to make these change. Everyone's working for the greater good. Our team will constantly be providing you and your team with thank yous and appreciation, but as the IRT leader, recognizing, appreciating, thanking your members as often as possible for the work that they're doing to help this initiative. Okay, so now we're on to implementation. So we've gone through exploration, where we collect the data, we assess it; preparation, where we review the data and we plan for implementation; and now implementation is the part where we'll start taking those strategies and really figuring out how we will adapt and implement them in your school setting. So for the implementation phase, each year, and I'll show you a little timeline that'll lay this out for you, you will be tasked with implementing 2 of the 6 strategies with support from our team, our research team, and our coaching team. So in the implementation phase, you'll have the 2 strategies, which will be selected during the preparation phase, and you will work with your IRT team and the rest of your school staff to implement these in your school. You'll meet with the IRT team during the implementation phase to discuss your process, how things are going, whether or not you've come upon any barriers, what changes are needed, if there are ongoing adaptations that might be needed to better implement the strategy. And again, our team will be there every step of the way to help you, to answer questions, to provide technical assistance, to coach you, to provide trainings, really anything we can do to promote your success in implementing these strategies. So once you have the strategies implemented, in the implementation phase for each 2 strategies, you'll have 1 year to work on 2 strategies. So each year will be 2 strategies over 3 years. As you finish the first 2 strategies, we don't say, okay, great, forget about that now. We have this perspective of sustainment, which is the idea that we want you to, from the beginning, be thinking about, how do I make sure this change sticks? I'm sure that many of you have had changes happen in your school, whether it's a new way of teaching, it's a new way of working with students, it's a new way of structuring the school day, and they are changes that require a great deal of time and effort and training. And then you find out a year or 2 later that all of that work is gone and things have really gone back to how they were before you even started. We do not want to see that happen with this project. We want your hard work to last for years and years and years and years to come. 1, so that you have that success of your hard work, but also so we can continue benefiting students over the years to come. And so we have a sustainment phase, and this is the phase where instead of just saying, yep, great, you did it, there it is, we continue to monitor those strategies. We look to see, are people happy with the changes that have been made? Are there any adjustments that need to be made? How is the process going? And so where needed, we may sometimes have to go back into the stage and prepare more data and make more changes so that we can keep those strategies going in the long run. So some of the data we collect during the sustainment phase include your satisfaction data and the satisfaction data from others in your school with this process and with the coaching, with the feedback, with the technical assistance. Are there things on our end that we should change so that we can better support your implementation of these strategies? We'll look to see how well the school is still doing these strategies over time. So we'll monitor, for example, if there's a change in the bullying policy, we'll look to see over time, is that bullying policy still in your school's active procedures? Are your schools using and following the guidelines in that policy? Is it something, if people are supposed to be actively addressing it, is it something that's being actively addressed? So we'll look to see, are you still doing what you planned in the years to come, in the years that follow? We'll look to see how far along you are in terms of your implementation process. When I get to some of the school self-assessment, you'll see that while I may say something like implement bullying policies as a strategy, there might be 10 or 12 different areas under that that could really help support that strategy. And so we'll look to see, really how ingrained is that strategy? How well is it implemented? And we'll observe your school. We'll go, members of our team will go and look to see how are things actually working so that it's not just all data report, but that we can see in real time, are things working? And then again, using this data to see, do we need adaptations? Are we still having fidelity? Are they having the impact that they should? and how can we on our end maximize our coaching and our technical assistance process to best help your success. Okay, so here's just a brief look at a timeline that would give you some ideas of how this all works. So as I've said, we've really been this school year collecting in that exploration phase all of that data. We're now in the spring and the summer and a little bit in the fall as well, going to help you with the preparation. That is, we'll develop our feedback reports, you'll review them, and then starting next school year, you'll, using the self-assessment tool, pick 2 strategies and start implementing them. And then as you see, while you're implementing the first 2 strategies, you'll also sort of start the process over again of looking at what you might need to do for the next year when it's time to implement the second 2 strategies. And so this implementation phase will continue. And then in the next school year, your first 2 strategies will be in the sustainment phase. So we'll be making sure that the strategies you implemented during this first school year really stick the next year while you're implementing the next 2 strategies and preparing for the final 2. And so again, you can see this is really an iterative process, and 2 strategies a year. We prepare, we implement, we sustain. And it's really that process over throughout the school timeline and throughout the project timeline. I'm going to give you a quick example of another area where this DAP has been used. I think it's always helpful to hear a little bit of real-world experience with such a process. And so I'm going to tell you a little bit about a different sort of a setting, which is a child welfare setting in public health. And so in Riverside County, again, I'm in California, so Riverside County is the next county over from San Diego. They decided that they had a public health nursing program that had been for 20 years implementing a great program that clients loved, the providers loved, but they weren't seeing any changes in their outcomes. They had sort of halted their progress. They wanted to see reductions in child abuse and neglect. They were going out to the homes, they were working with parents, and while parents loved it and providers loved it, their re-reports for child arrest or for child abuse and neglect were not being reduced. We weren't seeing improvement. And so the county decided they wanted to see a change. So they did, again, the exploration phase, which is noticing this problem, that there was a program that everyone really liked, but they weren't seeing those reductions. They were paying for services and they weren't really getting a return on their investment. They weren't seeing reductions in child abuse and child neglect. So we went in, we did some interviews and some web surveys with their staff and their leaders. We determined that the problem, again, was they had high rates of child abuse and neglect, and they were seeing high rates of return. So families who were treated were still coming back in and doing it again. That was their problem. We knew of a program called Safe Care. It's an evidence-based program. It's been research proven to improve parenting and reduce re-reports of abuse and neglect. But this is a big change for a system that's been doing the same thing for 20 years. So we needed to decide, how do we implement this safe care practice? How do we see if this is a good fit? So we did the interviews, the web surveys. We then had safe care experts and trainers who trained them in the process, provided them with coaching. We had an IRT to lead the process. Their IRT had people at the county level. It had a nurse leader. Again, these were public health nurses. Had an expert, an individual similar to your coach, who was an expert in the model. And then it had someone like me, who was a researcher, all working together to look at this system and figure out, how can we make this change? We know that there's a problem. We know that in other settings, safe care has worked to reduce child neglect. We also collected some data that showed us, because the clients and the staff were so happy with this program, they didn't want to change. So we had a big barrier from the start, which is we have a bunch of people who already like what they're doing, even though it's not working. So together as the IRT, our goal was to figure out, how do we change this system to doing this evidence-based practice? So the results were, we initially started, and we started smaller. We trained 12 of their nurses in 2011 to do the practice. We adapted it in ways that allowed them to retain, while doing the safe care program, some of the aspects they liked so much of what they were doing before. So we said, you have to do this core part of the model, the parts that we know have been shown to reduce neglect, abuse, but those parts that you really liked, that really made you feel happy about your job, let's find a way to integrate those with the model so that we can keep that. There was still some resistance, but they gave it a try. And we had people who emerged as experts in the model. We started again with 12 nurses. They've, in that time, expanded. There are now 36 of them, so they've tripled their workforce size in individuals. They tried it again. They wanted to see, if we start with 12, can we get people to do it? Will it work? Will they like it? They did. They expanded to 36, and they expanded themselves because they had individuals who ended up being so good that they themselves became coaches and trainers in the model. And so what we found was even though they used the adaptations to fit it to their context and to fit the parts of their job that made them happy, they still had high fidelity to the model. So the core parts that we know are impacting change in outcomes. They had high family satisfaction and completion rates. So the families were okay with it. The families didn't mind that this was a much more structured program. They liked it. And they finally saw that outcome that they wanted, which was that they now have less recidivism for parents in the child welfare system. So they were still able to do something they liked, but when they did it this time, they were able to see those reductions. And they, in fact, were featured as a success story in their Safe Care newsletter. So that picture that I showed you on the last slide was them and the evidence-based practice. Safe Care is out of Atlanta. So this group from Riverside, California, made it into the success story part as part of implementing and using this dynamic adaptation process. Again, they started in 2011. It's 2017. They're still doing it. So it was not one of those changes that came in, oh, we're going to do something different. And then a year later, they went back to doing what they had been doing previously. That's what we want to see. They kept it, they expanded, they have lots of success. And that's what we hope to do with your group as well. So I'm now going to get into just a little overview so that you can get sort of a preview of our school-wide self-assessment and planning tools. These will be instruments that your coach will work with you to go through and really assess your school. And so I'm going to give you an example of the strategies, and then I'll go through one strategy so you can see sort of the level of detail. But again, this isn't something that you need to start working on now. This is something that your coach will have the formalized version of these tools to work with you. But basically, for the school-wide self-assessment, we have our 6 strategies, and the overarching question for each one will be, does your school implement the following strategies to meet the needs of LGBTQ youth? And so these strategies are: 1, prohibiting harassment and bullying based on a student's perceived or actual sexual orientation or gender expression. 2, providing safe spaces such as the school health office, counselor's office, designated classroom, or student organization while LGBT students can receive support from administrators, teachers, or other school staff or students. 3, provide health education curriculum or supplemental materials that include HIV, other STD, or pregnancy prevention information that's relevant to LGBTQ youth. 4, encouraging staff members to attend professional development on safe and supportive school environments for all students, regardless of sexual orientation, gender identity, or gender expression. 5, facilitating access to providers not on school property who have experience providing social and behavioral health services to LGBTQ youth. And 6, facilitate access to providers not on school property who have experience providing sexual and reproductive health services to LGBTQ youth. So for these 6 strategies, you will pick 2 each year and go through in detail ways that you might be able to implement those strategies. As part of this assessment, you'll take each strategy, and I'm going to show you one example. So here's strategy 4, encourage staff members to attend professional development on safe and supportive school environments for all students, regardless of sexual orientation, gender identity, or gender expression. And you'll see here, these are the items that you would find in your school self-assessment. So I'll go through 2 example ones. The first one is at least 1 annual training is offered by school or district that addresses how school staff can contribute to fostering a safe and supportive environment for LGBTQ students. So you would go through that item and you would say, yes, if this is something that your school has. Do you have at least 1 annual training? No, if it doesn't. And in the event that you weren't able to get that information, you could put U for unsure. Another option, additional optional trainings, in person or online, that address how school staff can contribute to fostering a school safe and supportive environment for LGBTQ students are offered on an annual basis by the school or district. Again, so for each strategy, there'll be a number of sort of components or subparts to the strategy. These are also ideas when you're thinking about planning for places where you might, so you may have an annual training, but maybe you don't have supplemental trainings, or maybe you have resources, but they're not actually disseminated to staff. And so these give you ideas so that you can see where are your strengths and where are the opportunities for improvement. So after you go through each of those 6 strategies with those detailed yes, no, unsure, you would consider which one of them did you hope to work with, or which 2 of them do you hope to work with on this year. So again, looking at the strategies, looking at the data that you've collected from the feedback reports, what do you think are your priorities for the first year? And then this would be completed again during the preparation phase for the second year of implementation. So you'd identify your strategies, and then for those strategies that you selected, we want you to consider action items that you might want to consider. And thinking about, how important is it to your school? How expensive would it be to plan and implement? How much time and effort would it be? How enthusiastic would your school be? How feasible is it to implement it? So again, taking those 2 strategies that you selected, thinking about, okay, what are the steps that we can do? And you may use some of those sort of subcategories underneath the strategy to prime you for ideas. Your coach will be doing this process with you, and I can guarantee you that your coaches have lots of great ideas to help you come up with ways that you might implement your selected strategy. So then you would write your strategy and you'd put in your selected action items. What are really the things that we're going to do, rather than say, yes, we'll have trainings. Okay, how are you going to have trainings? What types of trainings? Who's going to lead them? When are they going to be done? So really assessing it and then developing these action plans. So an action plan explains how you'll achieve those goals. So it lists the types of actions and adaptations for each strategy. So you put your strategy, you come up with your goals. What are your outcomes? How would we know if you're really hitting that strategy the way that you intend to? What are those actions? So those action items that you've listed in the past step. When do you hope to do it? Who is responsible for it? And what types of resources and help might you need to meet those goals? So again, as part of this really planning process here, that your coach will work with you to really get down to what do we need to do? When are we going to do it? Who's going to do it? How are we going to do it? What help do we need to do it? Structured action planning. Okay, so and I think this is what I just said, determining who's responsible, how long, what human and material resources. So do you need other people outside of the IRT to help? Quite often you probably will. The IRT's job is not to do everything. The IRT's job is to assess and plan everything. This plan increases the chance that what needs to happen will occur. Writing it out, having a written plan has some accountability, and it will also save time and energy from just continually meeting, talking about things, making ideas. Again, we want to see this written, structured action plan that helps you follow objectives, hit the targets of your goals, and decide how it's happening, when it's happening, and then check in on that. So you'll monitor your progress. You'll look to see, did the actions happen as planned? Did they take place when they were supposed to? If so, let's evaluate. Why did that happen? How did we appreciate that success? What were the steps that happened to carry it out? And if there are things that prevented actions, what are those? Again, you're looking for what are our ongoing successes and what are our areas for improvement? Oops. So continuing, you want to know what are the intended and unintended consequences with the actions. So you'll have on that action plan, right? What are our goals? What are our objectives to make sure that we're doing this as we plan? They may be unintended consequences, both in the positive or ones that really are more of a barrier. But looking again, monitoring that progress. And this is part of sustainment as well, making sure that we really continue to monitor how well the strategies are being implemented and each action step and where we might want to change things. Are there mid-course corrections or adaptations that we need to better support the implementation of that strategy? And then, of course, most successfully, both in your action plans and in the entire project, are to identify and celebrate successes. So our goal in this dynamic adaptation process is for you to have the support you need and a structured process so that you can successfully change your school to be a place that has a school climate that's healthy and happy for all, and for you to be able to celebrate the fact that you've seen these changes and that you've implemented changes that hopefully will be there for years to come to support your students. And so I'll leave you with a quote from Florence Nightingale. I think once feelings waste themselves in words, they ought to all be distilled into actions which bring results. And that's exactly what we're trying to do in this project, is to not talk about the problem, but to put actions in place so that we can really change it. So I want to thank you for participating in today's webinar. I'd like to also thank our school nurse reviewers listed on this slide who have really helped us in working with the content and reviewing this webinar to make sure that it's appropriate for our participants. And then I'd like to leave you with the contact information for myself as well as for the study co-principal investigators, Dr. Kathleen Wilging and Dr. Mary Ramos. If you have any questions or need any follow-up for this presentation, please feel free to contact any one of us. And thank you for taking part in this webinar today. Enjoy the rest of your day.